Dear learners, welcome to the last topic of the Swayam MOOC course on Geography of Health and Well-being. Till now, we have covered the basics of health and well-being, nature, scope and evolution of health geography, factors affecting health and well-being, concept of risk, exposure, vulnerability, various national and international challenges of health, global burden of diseases and many related topics. But today, let us recall our very first lecture on what is health and what are the approaches to health. If you remember, health is defined as a state of physical, mental and social well-being and not just the absence of disease or infirmity. And geography is concerned with the identification and explanation of spatial structure, pattern and processes, and with the analysis and explanation of the links between humans and the environment. We have learned that health can be understood through social approach. These factors include political system, cultural norms, social status and individual identities. Studies like influence of race on the incidence of disease or role of community garden on spaces of healing come under its purview. It seeks to answer how do people from different cultural backgrounds perceive health and disease in different ways, or how the power structures are linked to health and healthcare. Which groups are excluded and why? Another significant approach to look at health is ecological approach, where human beings are recognized as part of the ecological system, and the commonest area of study is relationship between humans and their natural and built environment, which means that our environment shapes diseases, both communicable and non-communicable, and even mental health. We have also learned that the impact of air pollution, water pollution, improper solid waste management, occupation, etc. on our health in various modules. The prevalence of respiratory diseases can be linked to air pollution, while the access to green spaces can positively impact mental health and well-being. Similarly, the quality of drinking water and sanitation directly affects the incidence of waterborne diseases. The occupational environment, ranging from exposure to harmful substances in industrial settings to psychological stressors or high pressure of work environment, also plays important role in determining health outcomes. Finally, the third and a very important approach to health and well-being is the spatial approach. Mapping is the cornerstone of geography, and a map analysis brings uniquely geographic perspectives. It is the language that geographers speak. Just like any other language, maps to communicate, tell stories, communicate information and data. All through the module, you may have come across a number of maps. Some of them, the most spectacular maps, are created by Global Burden of Disease website, and many modules also refer to the John Snow's map of cholera epidemic in London. The spatial approach to health focuses on the geographical context of health outcomes and the spatial relationship between environmental determinants and population. So we, geographers, are not only looking at the health outcomes and determinants, but also analyzing them with respect to spatial distribution. The key is to know the variation in this distribution and uncover the reasons behind it. This perspective emphasizes how the distribution of health resources, environmental factors, and socio-economic conditions across different geographical areas influence health status as well as access to the healthcare. The spatial analytical techniques are used to answer healthcare questions, particularly location and connectivity. Since maps have always played a significant role in health, the use of geospatial technology, that includes GIS, which is Geographical Information System, GPS, and remote sensing technologies have had greater impact on geographic study of health than anything else. By employing GIS and spatial analysis techniques and GPS data, researchers can analyze the pattern of disease prevalence, healthcare accessibility, and even social determinants of health can be mapped. It can help integrate social, ecological, and spatial approaches together. The growing role of GIS as a tool for both qualitative and quantitative data makes it more attractive than ever. For example, mapping the locations of hospitals and clinics can reveal under-reserved areas with limited access to medical care, while spatial analysis of environmental hazards can identify regions at higher risk for certain health issues. Additionally, this approach allows for exploration of how proximity to green spaces, transportation routes, and community resources affects mental and physical well-being. Ultimately, the spatial approach provides valuable insights into health disparities, guiding targeted interventions and policy decisions aimed at improving health equity within communities, within areas. The geospatial technology are now intensively used by health researchers, administrators, and policymakers to store, analyze, and communicate spatial health data. Today, we will discuss the use and importance of this very important tool that was earlier used by only geographers, but now is widely used by architects, civil engineers, and scholars across different disciplines. That is remote sensing, GIS, and GPS, or the geospatial technology. Before discussing the application of geospatial technology on health, let us briefly understand these terms. GIS is a computer system that can manipulate, store, and analyze data that are referenced by location. A GIS is fundamentally a spatial database distinguished by the fact that it includes data on location of phenomena in a way that enables information to be mapped and analyzed. Databases are computer systems that store and manage information. They enable huge databases to be stored and managed and used effectively. All spatial information in GIS must be georeferenced first. That means the locations from the 3D globe must be transferred accurately on the 2D map to create a map on a computer using a software. To do this, we have to use projections. Once a system for defining and describing locations has been established, spatial features in the form of point, line, and area or polygons, these have to be mapped. For instance, we can store the point locations such as location of hospitals, clinics, emergency shelters, and so on, or line features that may be roads, street, footpath, railway, line, canal or power grid. And similarly, area or polygon features are mapped that may be districts, forest areas, urban areas, green zones, parks or any feature that is enclosed to form a polygon. Once the spatial features are mapped, the attribute data pertaining to these spatial features can be added in GIS. This additional information about the spatial feature is called attribute data. For instance, on the map of Delhi, you have located point data on location of hospitals. With this, you may wish to store attribute data on number of doctors or number of beds or patients visiting daily at each location. This data helps produce thematic maps. Thematic maps are maps which are created based on certain themes. These maps may be point distribution map, dot maps, flow maps, isoline maps, choropleth maps or maps with histogram, pie diagram and line graphs. For the purpose of mapping in GIS, spatial data is stored in either of the two spatial models. It can be vector data model or raster data model. A vector data model represents geographic features using points, lines and polygons. Points denote specific location. Lines represent linear features, for example roads or rivers, and polygon represent areas which are enclosed like lakes or different land uses. Each feature is defined by coordinate, allowing for precise representation of shape and size. It is best suited for representing discrete feature with clear boundaries such as administrative boundaries, transportation networks and point locations. Vector data is used for analyzing connections among locations or network analysis. For instance, the quickest routes between 2 points can be found using vector data. On the other hand, the raster data model represents geographic information as a grid of cells or pixels where each cell has a value that represents information such as color, temperature or land cover, etc. Each cell corresponds to a specific area on the ground and contains a single value, making it less precise for detailed feature but effective for continuous data representation. These are best suited for representing continuous phenomena such as elevation, temperature, land use, land cover, satellite imagery is used for this purpose. For instance, the temperature data for each pixel can be extracted from satellite image using GIS in a given area. Raster data is used for techniques like interpolation, density analysis and contour mapping. Another key feature of GIS is combining multiple sources of data. Each kind of data is stored in layers and all the layers are combined using GIS. This means that GIS has the ability to combine multiple layers of data, enabling the discovery and exploration of spatial pattern of different phenomena. For example, if you are interested in exploring the heart disease mortality pattern in Delhi, we can put together different layers such as district boundaries, pollution levels, income, level of urbanization, proximity to green areas, etc., and overlay them on each other to understand the pattern or relationship between incidence of heart attack and the contributing factor. In addition, to help map and the health data, GIS can perform queries. A query can be asked and suitable locations can be highlighted in GIS. For instance, query building for setting up a hospital, that is to identify suitable location based on various criteria. For this, we have to follow some steps. The first step is to define the criteria. This should include factors such as proximity to existing healthcare facilities, accessibility via major road and public transportation, population density, availability of land, distance from school and residential areas. So once you have defined the criteria, the second step will be to build attribute queries. Using GIS software, we can create attribute queries based on criteria. For instance, for query regarding proximity to existing facilities, we can ask GIS the query, select locations within 5 kilometers of existing hospitals, or with respect to population density, the query can be select census tracts with a population density greater than 1000 people per square kilometer. Finally, the third step is to build spatial queries such as for accessibility. The query may be select sites that are within 1 kilometer of the highway or public transport routes, or go for buffer analysis. That means create a buffer zone around existing facility, that may be a road or any other facility, to visualize the potential locations and identify overlaps with population density areas. All these multiple queries can also be combined. So combine the queries, we can use different methods, maybe like Boolean operators. For example, the combined query can be select parcels that are zoned for healthcare within 5 kilometers of existing hospitals, greater than 5 acres, and within 1 kilometer of major transport routes. So this is combining the three queries. After running the queries, the GIS software will return a set of potential hospital sites. You can analyze these sites. You may add additional factors such as environmental considerations, for example, disaster zones, flood zones, or community feedback and social determinants of health. And then finally, GIS enables you to visualize the results on a map, showing the selected sites alongside population density, existing healthcare facilities, and transportation network. This allows the stakeholders to evaluate potential locations effectively. Another significant geospatial technology is remote sensing. Remote sensing is the measurement of electromagnetic radiation reflected from the Earth's surface in order to record geographic information such as vegetation, rainfall, temperature, etc., without getting in physical contact with the area. The remote sensing began with the camera mounted, camera with the sensor that could be passive or active. These were mounted under a balloon first and then aircraft. Remote sensing utilizes various wavelengths of electromagnetic spectrum, including visible light, infrared, microwave, ultraviolet. Different materials reflect and absorb different wavelengths uniquely, allowing for identification of land cover, vegetation health, water bodies, and others. The earlier remote sensing utilized camera sensors loaded below hot air balloons and then on aircraft. This is called aerial photography. More recently, remote sensing uses satellite imageries, and now we also have images from drones, and this may be the future of remote sensing. The digital information collected through remote sensing is then uploaded on GIS. This is the raster data, and each pixel has a unique spectral signature or a digital number. With the help of remote sensing, pollution levels, temperature, humidity, wind, disasters, vulnerable areas, health related resources and infrastructure can be mapped that can facilitate spatiotemporal modeling. Another important tool is GPS, that is Global Positioning System. This is a satellite-based navigation system that allows users to determine their precise location, that is latitude, longitude and altitude anywhere on the earth. This was developed by United States Department of Defense. GPS was initially intended for military purposes but has since become widely used for civilian applications. The system consists of a constellation of at least 24 satellites orbiting the Earth. These satellites continuously transmit signals that contain their location and the exact time and signals were sent. Although a GPS device may be expensive, we also have mobile apps that can give GPS points. GPS plays a crucial role in various aspects of health and healthcare, like service delivery, research, and public health initiatives. This includes navigation, routes, mapping hotspots, to track physical activities and routes for runners, cyclists, and fitness enthusiasts, and so on. With the recent developments in technology, internet, 3D mapping, visualization tools, dynamic mapping, and use of drones and global positioning systems, the utility of GIS continues to grow for health studies. In the next module, we will discuss the application of these geospatial technologies in the areas of health geography. Here is a list of references that may be useful for better understanding of the subject. Thank you.